Welcome back to Living Local. Well, major depressive disorder, PTSD, are conditions that should not be overlooked. Treatment can truly make a difference, especially one treatment that has been starting to change so many lives. That's ketamine. Dr. Jeff Gainuk is here, and Dr. Chuck Weber, CEO of Direct Care. How are you guys?
We're very well. Thank you so much. Thank you for having us.
Well, this is a big subject. I mean, it's always good to talk about PTSD. It's always good to put some light on major depressive disorder. But before we go into any more, I want people to learn who you guys are right here in Colorado Springs.
Sure. My wife, Dr. Rayanne Weber, she's also a veteran and a physician. She started in 2014 Direct Care.
Okay.
So Direct Care and Ketamine of Colorado Springs, where we serve the most vulnerable of our population.
Right.
So our first focus was actually opioid addiction treatment.
Okay.
And then we expanded with ketamine. And ketamine has been amazing. There's not been a medication in my inventory, so I'm a psychiatrist.
Okay.
And a vet too. We're all vets. And there's not anything in our inventory that can react so quickly, that can get a major depressive disorder, especially treatment resistant. In other words, you've failed multiple meds, you've tried talk therapy, you've tried maybe even ECT, and this can actually make a huge difference.
You know, this is the salvation for so many people who are going through this, because I can't imagine what life is like going through some of these. I mean, when you talk about major depressive disorder, PTSD, only they understand what they're going through, and to have something that's truly making their lives better is a great thing. How do you see that, Dr. Gainuk, with ketamine? What difference have you seen in some of the patients?
So we have patients who come in who, like Dr. Weber said, have failed multiple other therapies. Patients who have had treatment-resistant depression or major depressive disorder for 10, 15, 20 years and have just been able to get their arms around the symptoms. Within one infusion of ketamine, within an hour, these patients have decreased symptoms. And then we do 6 infusions over 2 to 3 weeks, and those get better and better and better with time.
That is unbelievable. And when you get to see the change, that's where it truly matters, because there's something working and it's changing their lives for the better.
Correct.
One thing I want to point out is something very unique about you two. Veteran-owned clinic. Both of you have served. Why is that so important?
Well, I think, one, it's good for our community. You know, for some reason, there's only 1% of all Americans have kind of served, and so we already understand our community here. We understand the veterans, but we've also taken that expertise. So if we have a treatment modality or we have skills, we've already been tested in probably the most adverse and most harsh environments. So doing it in an office-based, you know, it's pretty easy. And so in that sense, and so we want to take that expertise to the masses, to our community. This is where we've decided to retire. This is where we're going to raise our kids. And so we're going to do it for Colorado Springs.
That is incredible, and thank you for your service, by the way. So somebody watching this morning says, I could definitely benefit from this ketamine treatment. What is the process like?
So the first part is they've seen a psychiatric practitioner and carry a diagnosis of major depressive disorder or PTSD or anxiety. Then you schedule a consult with us. It's free. I'll talk to the patient, discuss your symptoms, discuss other things you've done, and then if ketamine is the right fit for you, you'd come into our clinic. I would start an IV on you, take your vital signs. I'm there for the entire infusion. It lasts about 40 minutes long. I stand right there and make sure that if there's any issues, I'm a trained anesthesia provider, so you're in good hands. I've used ketamine for over 10 years, and like Dr. Weber was saying, in the battlefield environment. I just got out in 2017. I was in Syria. So I'm very familiar with this drug, and the true hero is using it in the sub-anesthetic dose. We're really starting to help people. We're not giving that large dose that you would use for an anesthetic. It's a sub-anesthetic dose, which actually, down the line, causes neuronal growth in the brain, increasing neurotransmitters, which actually really benefits these patients.
It sounds like you're making a huge difference. Thank you both for being with us this morning. And look, at the end of the day, if you are struggling with major depressive disorder, PTSD, this is the team to come to. They're going to change your life for good. All that information is up on your screen right now. Ketamine Colorado Springs partnered with Direct Care LLC. There's that phone number. You can always go online for more information. It's ketamineCOSprings.com, and follow them on social media, of course, for all of their updates. Thank you so much.
Thank you.